Hello everyone, my name is Yann Ruffieux, and it is my pleasure to talk about our work here on behalf of my co-authors. I will be presenting our study of the treatment gap for mental disorders in South African HIV treatment programs. I will state that this work was presented at the CROI conference last month. Mental illness is an important cause of disease burden in South Africa. A study from 2009 called the SASH study estimated that about a third of adults in South Africa experience a mental illness at some point in their life. What's more, these illnesses often go undiagnosed or untreated in what we commonly refer to as the treatment gap. This is especially problematic in people living with HIV, since untreated mental disorders are known to have negative interactions with the treatment of the virus. Our main aim with this study was to quantify this treatment gap in a set of HIV programs in South Africa. Additionally, we set out to identify disparities between these programs in terms of their access to mental health care. For our study, we defined the treatment gap as the discrepancy between the prevalence of mental disorders in people living with HIV in South Africa and the proportion of patients in HIV programs who received treatment for a mental disorder. So to obtain the first value, which we called alpha, we combined data from the Global Burden of Disease study with an estimate for excess mental disorders in people with HIV. As for the second value, we separated the HIV programs based on the type of care they were affiliated with. That means public primary care, public tertiary care, and private care. And we produced a separate proportion for each of these types of care. Finally, we combined these two estimates into this formula, and this is our treatment gap, which we expressed per type of care. And as you can see, the larger the discrepancy between the numerator and the denominator, the closer the treatment gap will be to 1 or to 100%. In a separate analysis, we computed rate ratios comparing treatment rates for mental disorders across the different types of care. On the left here, you have a summary of the HIV programs which we analyzed per type of care. The majority of patients were women with a median age in the early to mid-30s. And on the right, we display our estimates for the treatment gap per type of care and per year from 2012 to 2017. So clearly there was a substantial treatment gap across all types of care, albeit to varying degrees. In 2017, in the public primary care clinics, we estimated that over 95% of patients with a mental disorder were not receiving any treatment for that disorder. The treatment gap in tertiary care was a bit lower, hovering around 75% across the 6-year period. And finally, in private care, the treatment gap settled at around 40% in 2017. This is our analysis comparing mental health treatment rates in public primary care to those in private care. For this analysis, we differentiated between hospital and pharmacological treatment for mental disorders, and also between different types of mental illnesses. So private care is the reference here. And our analysis shows that the rate of treatment for mood and anxiety disorders was much lower in the public primary care sector, in particular by a factor of around 20 for mood disorders in green, and by a factor of nearly 50 for the particular case of treatment by anxiolytics. The disparity was not as pronounced when it comes to psychotic disorders. In fact, hospital admissions for a psychotic disorder were more common in public primary care than they were in private care. To summarize, we identified a substantial treatment gap for mental disorders in HIV treatment programs in South Africa. Additionally, there were disparities between the public and private sectors, with less severe mental disorders such as anxiety and depression remaining largely untreated in public primary care. To finish, I would like to thank my co-authors and the institutions who collaborated on this project. Thank you for your attention and enjoy the rest of the meeting.